You are rebreathing your own air, which means that inhaling more and more carbon dioxide, which you are expelling every minute. Government is doing the right thing. Lockdown is necessary, and I would advise, I would wish that it extends even 2-3 more weeks. In this war, any war needs some sacrifice, right? It's not just like you're taking a knife and you're penetrating someone's abdomen. Even this is a crime. This is an equivalent crime. It is even a deadly crime. Yes.
Hi friends, welcome to the episode 2 of Talk Real with Arjun. Today we are going to talk to a person who is from an industry which is considered gods and angels during this pandemic. Of course, I'm talking about healthcare industry. Dr. Arun, who is currently pursuing third year of his master's in MS in orthopedic surgery from Coimbatore Medical College, India, and he has actually finished 3 years of his residency and waiting for his final exams that got postponed because of this pandemic. Dr. Arun finished his MBBS from Madras Medical College and happened to be my friend. I've known Dr. Arun for a long time and I can attest to this. He's one of the sincere and very disciplined guy committed to his craft. Another reason I wanted to get with him today is because I saw his Facebook post that he's currently treating patients who are coronavirus affected from Coimbatore, India. So I wanted to get with him to understand the real world situation of what's happening within the ward. And get more into the treatment and the things which not many people usually talk. We are going to hear everything, all the real life stories from the man himself today. Welcome to the podcast, Dr. Arun.
Hi, Arjun. How are you?
I'm doing good, man. I'm actually doing fantastic because there is nothing much to do for us in this pandemic. Pretty much, I'm sitting inside the house all the time, which is what everyone is asking us to do. But how are you
Yeah.
doing actually? I mean, I know you are a pretty busy man. The goal of this episode is to just have a friendly conversation about the virus itself and what's happening inside the ward and go much more detail into the treatment itself. Thank you so much for taking time off today.
Thank you, Arjun. It's my pleasure. Creating awareness in this time of pandemic. Happy that you've asked me to do it.
All right, let's dive into this topic, buddy. Um, I know you've had many dreams after this graduation, so your exams were postponed. How did your life change before and after the pandemic?
Yeah, it's just the same as everybody else. I can't go out, chill out with friends, have some me time, and it's the same. But as a doctor, my work pattern has changed. I have stopped going to the OTs, doing my regular trauma duties since I'm doing my orthopedic residency. Here we see hundreds of OPDs each day. We treat around 70 plus coronavirus positive patients and a lot of isolated patients in isolation ward too.
So, if I'm understanding it right, you are studying orthopedic surgery, and you're completely dealing with bones and stuff, right? So now, since this pandemic has occurred, all the doctors who finished MBBS are being put into coronavirus ward and treating the patients, correct?
Yes, exactly. Yes.
So, what is your normal ward hours? And right after the coronavirus outbreak, how did your ward hours change? I know, I mean, everyone is talking about working hard, but I want to get some quantification on that.
Exactly. Right now, we work in 3 shifts, contains 4 to 5 doctors in each shifts. So we work around 8 to 10 hours a day. So we take rest for the rest of the time. We wear our personal protection kits, go inside the wards, uh, talk to the patients, ask their complaints. So in isolation wards, we send them for tests. So we see them. If they are negative, we send them back to quarantine. They are tested positive, we send them to corona positive ward. The other part is OPDs. So patients who are suspected to have corona infection are sent to our hospital all around 4 or 5 districts surrounding the place. We see whether they have this fever, dry cough, or any shortness of breath with any contact or history or travel history. So based on that, we advise the patients. We ask them to get home quarantine or get admitted. So this just simplifies our work pattern.
So, okay, so you're actually, to summarize your answer, you're actually categorizing into three parts, right? Whoever got coronavirus positive tested and negative, but you guys are asking them to stay in quarantine for like, for some time. And, whoever you guys suspect could have positive virus. So you guys are isolating them as well and treating them as well, correct?
Yes, exactly. Even in the hospital, he might have contracted a corona positive patient. He might have contacted him and he might be in his incubation period. So for safety reasons, we quarantine them for some time. And
Makes total sense to me. I think that's the way to go. I mean, why it's virus, we can't even predict when we get and how we contract.
yeah,
Another thing, like you touched upon being in the production kit, right? I mean, like we see pictures of doctors wearing the gown and they wear this yellow masks and stuff. But can you explain, how heavy it is, or what's it like, wearing the gown, and like what kind of precautions you guys take before approaching the coronavirus positive patients?
yeah, we call it as PPE. It's called personal protection equipment, and we wear N95 masks. These masks, they say it filters around 95% of virus particles, aerosols. So that like you don't contact the virus. The virus, if it sits on your mucosa, it just attaches and makes you get the disease. So these PPEs, these equipments are designed in such a way it has multiple layers. It doesn't allow any virus particles or even air or water, whatever it is, to percolate inside you. So it is basically like an astronaut suit. You're just living inside it. You're just breathing it. Just that we don't have any oxygen supplies. We just breathe our own air. So it's very airtight. So that's why you might have seen people in social medias posting like the impressions which makes on the face and nostrils and all that. More than all those physical pain, you are rebreathing your own air, which means that you're inhaling more and more carbon dioxide, which you are expelling every minute. So in that sense, it makes you more hypercapnic, which means you are inhaling a lot of carbon dioxide. So for imagine it's for 6 to 8 hours. So the more and more time you're there, you feel like panting. You feel like uh, you're hungry for air. And I just read about it that a lot of deep sea divers, all those people, they get all these because they have all these rebreathing circuits. They keep rebreathing their own air. So apart from the physical pain, we go through all this. Like we get severely fatigued after our duty hours wearing this PPs. So we just go back and sleep for 8 to 10 hours. It's very difficult. Um, it's actually a lot of suffering for any healthcare professional working right now in the corona wards. So
I felt it's heavy, but I never knew actually you guys have to inhale your own carbon dioxide again and again. That's against the nature, right?
yeah, but what to do, man? This is a crisis. This is a war.
Wow. I mean, it's sad to know like how tough, but it's also funny to, see all the posts of people saying that, they're getting bored inside the house and, stuck, they feel like they're stuck inside four walls and stuff. But I mean, comparing to the amount of, struggles you guys go through in treating the patients, I think we are all better off for sure. We at least have some fresh air coming in, and we can go outside on top of the terrace and just take 10 minutes walk or something. And whoever watching or listening to this, hopefully they can understand all the struggles you guys are going through, and think about everything before stepping out of the house, and help stop spreading the virus.
Yeah, you summarized it rightly. Hope this all ends so soon. Like we all like flock together. Yes.
Okay, so I want to talk a little bit about the journey of a patient from the time like you guys suspect the patient is coronavirus positive, and what happens in from your perspective. How do you guys approach the whole situation?
So some a patient comes to us. He has either fever or cough or shortness of breath, or he has any of these symptoms. Shortness of breath in the sense like they have chest tightness, they have difficulty in breathing. So if they have all the symptoms and they have a history of contacting a person who has traveled from a foreign country, high risk country, or they themselves have traveled, them to get admitted. We take labs. So if the patient is positive, we send them to corona ward. If he is negative, we ask them to stay back in the isolation ward and again get quarantined at same place for like 14 days, and we send them back to home. So if you don't have any such pertaining symptoms, So if you suspect it's not a coronavirus infection, so we advise you to take a lot of fluids, take antipyretics, and stay at home in the safer side. And on the other hand, if you're corona positive, so we take repeated samples, we monitor you daily, we make sure you're not getting worse. So and when the patient recovers, like we just discharge them and ask them to stay at home for another 7 to 14 days. So this is pretty much the protocol we follow right now.
Okay, from a layman perspective, I have a basic question. What's the difference between, or what's the temperature difference between normal fever and coronavirus fever? Is there any?
Actually, I can't just say about specific temperature difference, but coronavirus is something which actually causes, it's just another common flu, a virus causing a common flu. But this one is some severely mutated virus. You heard of SARS virus in 2002, right? And Middle East respiratory syndrome a few years back. So all these were caused by coronavirus. But this virus is something which has mutated in itself in some wild species, and which humans have contacted, and it has spread in such a way that it has just the way it attaches to the human body, the way it reacts. We are still researching about it. So that is why there is some difficulty in developing the medicine or using a specific medicine to cure it. So coming to the symptoms, just like any flu, you get myalgia, arthralgia, you get body pain, you get fever, a cough, you get upper respiratory tract infection like signs, symptoms, uh, difficulty in breathing. So all this. So these are all just overlapping symptoms with other flu-like conditions. But a common cold is actually very mild. We would have all suffered common cold due to the seasonal variations. So parents say seasonal cold. The mortality is very, very less. Even if you're very old, it's like less than 1%. But here in this instance, it's like 3 to 4%. Research says currently it's around 3.7% world, especially the older patients, because they say there is something called the cytokine storm, which is like your house goes on fire and you forget to switch off the fire alarm. So thousands and thousands of firefighters keep coming, right? It never stops. So in the same way, the body overreacts with producing while fighting against the virus, and it makes the patient so sick and to a fatal state. So to summarize, it's just another like common cold like virus, but it is a mutated severe form.
So,
Severe, yeah.
I mean, even though it looks like very technical, this is a valuable information because this is
Yeah,
what is making it so dangerous, right? Like it
yeah,
comes to your body and then it mutates and then it multiplies and makes more severe, where as compared to the common flu, that just causes some symptoms and then goes away, right?
exactly. Yeah,
Okay.
right.
Wow. I mean, this is serious, man. Like I feel like this is like a war within body itself, you know?
Yeah, yeah. Actually, that's what they say. It's a bio war. We,
Yeah.
we don't know the enemy, and we don't know the enemy. Yeah, we have to protect ourselves. Stay clean. Stay at home. Yeah.
Yeah, and so you talked about the testing procedure, right? Like, what makes it positive? Like, I mean, I know everyone keeps talking about test kit, but what exactly are you guys testing?
It is said that the viral load is higher near your mucosa around your throat, your pharynx. It's your inner part of throat. So, like we get a swab from the uh, by swiping the tissue from your pharynx, so in the throat. So we test them. We test them for the virus inside the lab. The microbiologist tells us the coronavirus is present there. So it is active. It is an active infection. So a throat swab is right now the most consistently and proven test, which is used everywhere. It's a simple, little bit invasive, not like little bit penetrating inside you, little bit uncomfortable. Yeah.
This question could be dumb. Trying to ask, like, what makes it so severe? Like, how do you find it's active? What if the virus is dead?
No, actually, if the virus is there, it means it's alive. Virus is something which people still fight whether is virus is a living being or non-living being. So if there is coronavirus particles inside you, if it is positive in the throat swab which they have taken, if it is there, it is there. You're corona positive. You have this virus inside you multiplying. So the disease severity is only like it is uh, how you react to it, how much your body reacts to it. So it is all clinical. It is how you observe. You just diagnose it while seeing and treating the patient by eliciting the clinical signs. How is this oxygen saturation? So whether his body is doing fine, whether it's coping up, whether it's like a common cold, or he's going severe. There are a lot of deposits getting inside the lung. His lung is fully opacified. It's filled with a lot of nonsense, and the patient is very finding it very difficult to keep himself active and calm. So it is mainly clinical. The severity is mainly clinical. We can't do a test and say whether this patient is severe or not severe. It can only identify whether you have the virus inside you.
Okay, that, I mean, I learned something today, which is good. So it's just that we can mitigate the whole effect of the virus, but virus will stay no matter what, right?
Exactly.
Okay, makes sense. Um, Next, I mean, I this is a very sensitive topic. I was thinking, so long before asking this question, but let me put it anyway. I've read very sad news about doctors and nurses who have died actually, by treating patients who are coronavirus positive. I mean, I know it's very emotional. Like, how do you particularly cope up, or how do you balance both side of it? Like, you have your, I mean, you've come to the profession, but what is your coping mechanism? You're very prone to like this virus since you're treating in the same ward. How do you balance it?
It is exactly just like going to war, but the enemy is unknown. So there is no better calling that than during this crisis. So you have studied and taught to treat patients. So this is the time we have to show uh, like the society is helpless without doctors and paramedics right now. So they don't know whom they are fighting against, what it is going to do to them. So, any doctor will feel that he is more responsible more than ever, because the community is so afraid. Everywhere people is panicked. Even the government is shutting down. So to be precise, to answer this question, we can say mm, we risk our own lives each day. Not just me, any healthcare professional, any doctor, any nurse, or any healthcare worker who is even sleeping inside the ward is risking his or her own life and his family. Is going to miss his family, is risk his own life to just eradicate this virus from our society. So yeah, we all have that fear inside ourselves. We take all the necessary precautions, what we can do. The government is providing us everything right now. I haven't faced any scarcity. Nobody has forced me to work without any equipment. They've given me all the PPEs, where even the doctors and healthcare workers are from United States asking government to supply enough PPEs. But here it's all there. Um, Everybody is asking us to keep ourselves safe. Uh, yeah, but we don't know, right? Where is the enemy? Anything can happen anytime. So it's just a risk. We all have that fear while going to work. Everybody has it while working.
It's really like going to the war, as you mentioned.
Exactly. Yeah. So all this can stop. All this nonsense can stop by just one thing. If people just stay at home, nothing else, nothing else. Eat the food you like, sleep how much hours you want. Just don't step out of your home. That is the only thing we ask you.
Well, government actually is allowing people to step out for necessity things, right? Do you think that should also be banned?
Uh, No, actually, when you think from people's perspective, they face their own difficulties. Example, these daily workers. So people who need necessary things which may not be available during this lockdown. Apart from this, the shops, this medicines, it's open. But in this war, any war needs some sacrifice, right? So maybe the government can. It's just my wish. Like the government is doing its best. Just my wish that they can do some door delivery or door-to-door service. Like a lot of engineers and brilliant minds are sitting at home. Like they can develop a lot of apps, help unite people, create even more awareness not to step out, and like we can help the people to get available things right at the doorstep. Especially in a country like India, where you can't educate every person. Example, like, have you heard any country in the world people bursting crackers during this crisis
No.
and celebrating? No, it's not right. Like I was finishing my duty at 9 o'clock on April 5, and I was out. I could see like a bunch of young people shouting on the roads, firing crackers. It was very disappointing because I was just seeing patients who are psychologically very troubled, being there, very sick, very afraid. And outside, I see anybody can get in inside anytime. Nobody knows. It's all there. You don't see the enemy at all. It might be just around you. So, like, I see a lot of posts on social medias, people standing in markets and fish market or vegetable market or whatever it is, people standing in bunch. At times, they are little loose. It's okay. Like, we won't get infected. So nothing, there is nothing like that. We are all at risk. We are all at 100% risk. It's just that we don't know. So yeah, this is what like it's better. The government is doing the right thing. Lockdown is necessary, and I would advise, like I would wish that it extends even 2-3 more weeks and see whether the cases are getting decrescendo.
Yeah,
Yeah,
I
that's
think
it.
most probably, I mean, everyone is saying, and all the news articles are posting that, lockdown is going to extend for like 3 more weeks or 2 more weeks.
That's actually very good. That's actually very good. That's needed. That's needed.
Yeah, and people who are, obliged to the government rules, they are staying inside the house. But there is quite a good amount of stupidity around.
Yeah, sorry to say that, but it just frustrates people.
I
Like you can risk your own life, but you cannot like affect the community. You can't risk others' life. You have no power to do it. So if you're staying out of your home, remember you're risking the entire community, not just you.
Well, it is against the law, to be frank. 144 section, which means you have to stay inside the house. And if you go out and if you spread the virus, that's like a criminal act, to be frank.
Exactly. Not just like you're taking a knife and you're penetrating someone's abdomen. It's even this is a crime. This is an equivalent crime. It is even a deadly crime. Yes. We also see a lot of responsible citizens. Like they even if they are going to shop something, they maintain 1 meter distance. Like yeah, it all comes to discipline at the end.
Yep.
So education is just a tool. It's all like yeah.
That's a huge word, actually, discipline. I mean, I never understood the real meaning until I got into this quarantine, because you were pretty much stuck with like few options here, right? You can either stay or like just sleep, or like eat, or like just do something online. But you have to stay disciplined in that to survive this quarantine, because it affects you psychologically. It affects your sleep cycle, actually, right?
Exactly. It's a responsibility. It's a responsibility.
That's a right way to put for sure. Finally, like, if you have to spread a message to people who are or normal citizens like me, what it would be?
Hmm. Yeah, that's a very good question, man. Uh, it's the need of the heart. Mm, First thing first, I would ask you to stay at home, not to step outside your home, whatever it is, and keep yourself very clean. So, like, the virus can spread either through direct aerosols from the affected patient or through fomites. It might act as a vehicle. It might act as a bike. It is small invisible creatures. Might be in a dust or sofa, whatever, or in the dump. So the virus particles may sit on it and it might travel anywhere, this fomites. So the community spread occurs mainly through fomites. So even if all this attaches to your skin, it's not going to penetrate you. So all you need to do is just take a bath twice or thrice a day. So keep yourself very clean. And it is said that an average person takes his hand around his face for around 8 to 14 times per minute.
Wow.
So that is why everybody advises you to with any alcohol-based sanitizers or even just a soap. Something is better than nothing, right? So like keep yourself clean, maintain hand hygiene, and if you are going to step out, just please wear a mask, protect yourselves and protect others. So all this, and don't believe in any message spread other than the health officials or the government. There are WHO websites and the Ministry of Health and Family Welfare websites from India, and follow the news which the government says, and don't follow the advices by any crooks or any fraudsters.
100%, man. I think that's a fair message. And from my observation, the government is also doing everything they could, to try to control this pandemic. I think we have acted very swiftly as soon as the outbreak happened. With a country like 1.3 billion population, I don't think there is no other way except a lockdown. I think
Exactly,
we should
exactly, exactly,
as being like everyone says actually you have to be a responsible citizen by just voting, but this is our test time. We have to actually stay inside the house and prove ourselves as a responsible citizen for the country.
exactly, exactly,
And hopefully
exactly.
this episode can help spread the message that how much struggle you guys are actually going through, to treat this whole pandemic, right? And whatever we are doing is just a small part of contribution. So hopefully that creates an awareness, and everyone, keeps all these things in mind before step out of their home.
Exactly, I feel the same. I feel that the right message reaches at the right time to the people. Yeah, creating awareness is something which is very needed at this point of time. People might know it, but being a person who has seen those patients and worked inside, I feel responsible to share all this to the people who might actually want to listen or might take one or two points or tell someone. So that is the point. I'd be very happy if that happens.
Again, I thank you so much for taking time today after your duty. I know you're pretty tired. I don't want to take up much of your time, but thanks again for spending like 30-40 minutes with me explaining all these answers. Hopefully, I'll meet you soon once everything is done, right? And we can hang
Yeah,
out.
yeah, I'm waiting for it, man. I'm waiting for it too. Yes.
All right. Until
And
then, you take care, man. Take care of yourself, and I'll see you soon.
thank you, man. It was my pleasure. Thank you very much.